Presented by Caltech.
Now, it is my great pleasure to introduce our speaker for the day, Atul Gawande. Dr. Gawande is the Samuel O. Thiel Professor of Surgery at Harvard Medical School and also serves as a professor in the Department of Health Policy and Management at the Harvard M.P.H. Chan School of Public Health. He's a surgeon, and he also writes very well. And he's the chairman of Lifebox, a non-for-profit organization created with the goal of making surgery safer worldwide. Dr. Gawande writes on significant medical and public health challenges in the 21st century. He is a staff writer for The New Yorker and has written 4 New York Times bestsellers, including Being Mortal, Medicine and What Matters in the End, published in 2014. His perspective on medicine, science, technology, and the humanities brings together important elements of a Caltech education, and we are fortunate to have him with us today. So please join me in welcoming Dr. Gawande.
Congratulations, class of 2016. If Caltech has done its job, and I kind of suspect it has, you're all scientists now. English and history graduates, sorry, all 4 of you. Even you are too. Science, you have to understand, is not a major and it's not a career. It's a commitment to a systematic way of thinking, a commitment to an allegiance to a way of building knowledge and explaining the universe through testing and factual observation. The thing is, this isn't a normal way of thinking. It is unnatural and counterintuitive. It has to be learned. Scientific explanation stands in contrast to the wisdom of divinity and experience and common sense. Common sense once told us that the sun moves across the sky and that being out in the cold gives you colds. But a scientific mind recognized that these intuitions were only hypotheses. They had to be tested. When I came to college from my Ohio hometown, the most intellectually unnerving thing I discovered was how wrong many of my assumptions were about how the world works, whether it was the natural or the human-made world. I looked to my professors and fellow students to supply my replacement ideas, and then I returned home with some of those ideas and told my parents everything they'd got wrong, which I'm sure they loved. But even then, I was just replacing one set of received beliefs for another, and it took me a long time to recognize the particular mindset that scientists have. The great physicist Edwin Hubble, speaking here at Caltech's commencement in 1938, said, "A scientist has a healthy skepticism, suspended judgment, and disciplined imagination, not only about other people's ideas, but about his or her own. The scientist has an experimental mind, not a litigious one." As a student, this seemed to me to be more than a way of thinking. It was a way of being, a kind of weird way of being. You're supposed to have skepticism and imagination, but not too much. You're supposed to suspend judgment, yet exercise it. Ultimately, you hope to observe the world with an open mind, gathering facts and testing your expectations against them. And then you hope to make up your mind and either affirm or reject the ideas at hand. But you also hope to accept that nothing is ever completely settled, that all knowledge is only probable knowledge. A contradictory piece of evidence can always emerge. Hubble said it best when he said, "The scientist explains the world by successive approximations." The scientific orientation has proved to be immensely powerful. It's allowed us to nearly double our lifespan during the last century, to increase our global abundance, and to deepen our understanding of the universe. Yet scientific knowledge is not necessarily trusted out in the world. Partly that's because it's incomplete. But even where the knowledge provided by science is overwhelming, people often resist it. Sometimes they outright deny it. Many people continue to believe, for instance, despite massive evidence to the contrary, that childhood vaccines cause autism. They don't. That people are safer owning a gun. They are not. That genetically modified crops are harmful. On balance, they've been beneficial. That climate change is not happening. It is. Vaccine fears, for example, have persisted despite decades of research showing them to be unfounded. Some 25 years ago, a statistical analysis suggested a possible association between autism and a preservative, thimerosal, used in vaccines to prevent bacterial contamination. That analysis turned out to be flawed, but the fears took hold. Scientists then carried out hundreds of studies and found no link. Still, fears persisted. Countries removed the preservative, but experienced no reduction in autism. Yet fears grew. A British study then claimed a connection between the onset of autism in 8 children and timing of their vaccination for measles, mumps, and rubella. That paper was then retracted due to findings of fraud. The lead author had falsified and misrepresented the data. Then repeated efforts to confirm the findings were unsuccessful, and nonetheless, vaccine rates plunged, leading to outbreaks of measles and mumps that last year sickened tens of thousands of children across the US, Canada, and Europe, and resulted in deaths. People are prone to resist scientific claims, your claims, when they clash with intuitive beliefs. They don't see measles or mumps around anymore. They do see children with autism, and they see a mom who says, "My child was perfectly fine until he got a vaccine and became autistic." Now, you can tell them correlation is not causation. You can say that children get a vaccine every 2 to 3 months for the first couple of years of their life, so onset of any illness is bound to follow vaccination for many kids. You can say that science shows no connection. But once an idea has got embedded and become widespread, it becomes very difficult to dig it out of people's brains, especially when they do not trust scientific authorities. And we're experiencing a significant decline in trust in scientific authorities. The sociologist Gordon Goshaw studied US survey data from 1974 to 2010 and found some deeply alarming trends. Despite our increasing education levels, the public's trust in the scientific community has been decreasing. This is particularly true among conservatives, even educated conservatives. In 1974, conservatives with college degrees had the highest level of trust in science and in the scientific community. Today, they have the lowest. But that pattern is across the board. We have today multiple factions putting themselves forward as what Goshaw described as their own cultural domains, generating their own knowledge base that is often in conflict with the cultural authority of the scientific community. Some are religious groups challenging evolution, for instance. Some are industry groups, as with climate skepticism. Others tilt more to the left, such as those that reject the medical establishment. As varied as these groups are, they're all alike in one way. They all harbor sacred beliefs they do not consider open to question. To defend those beliefs, few dismiss the authority of science today. They dismiss the authority of the scientific community. People don't argue back by claiming divine authority anymore. It can make matters incredibly confusing. They argue back by claiming to have the truer scientific authority. You have to be able to recognize the difference between claims of science and of pseudoscience. Science's defenders have identified 5 hallmark moves of pseudoscientists that you need to know. They argue that the scientific consensus emerges from a conspiracy to suppress dissenting views. They produce fake experts who have views contrary to established knowledge, but do not have a credible scientific record. They cherry-pick the data in papers that challenge the dominant view as a means of discrediting an entire field. They deploy false analogies and other logical fallacies, and they set impossible expectations of research. When scientists produce one level of certainty, the pseudoscientists insist they achieve another. It's not that some of these approaches never provide valid arguments. Sometimes an analogy is useful, or higher levels of certainty are required. But when you see some or all of these tactics deployed, you know you're not dealing with a scientific claim anymore. Pseudoscience is the form of science without the substance. The challenge about what to do about this, how to defend science as a more valid approach to explaining the world, has actually been addressed by science itself. Scientists have done experiments. In 2011, 2 Australian researchers compiled many of the findings in the Debunking Handbook, and the results are sobering. The evidence is that rebutting bad science doesn't work. In fact, it commonly backfires. Describing the facts that contradict an unscientific belief actually spreads familiarity with the belief and strengthens the conviction of believers. It's just the way the brain operates. Misinformation sticks, in part because it gets incorporated into a person's mental model of how the world works. Stripping out the information, therefore, fails because it threatens to leave a painful gap in that mental model, or no model at all. So then what is a science believer to do? What's a science graduate to do? Is your future just an unending battle of warring claims? And I don't think it is. Emerging from the findings was also evidence that suggested how you build trust in science. Rebutting bad science may not be effective, but asserting the true facts of good science is, and including the narrative that explains those facts is even better. You don't focus on what's wrong with the vaccine myths, for example. Instead, you point out giving children vaccines has proved far safer than not. How do we know? Because of a massive body of evidence, including the fact that we've tried the alternate experiment before. Between 1989 and 1991, US vaccination among poor urban children dropped. The result? 55,000 cases of measles and 123 deaths. The other important thing, then, is to also expose the bad science tactics that are being used to mislead people. Bad science has a pattern, and helping people recognize the pattern arms them to come to more scientific beliefs themselves. Having a scientific understanding of the world is fundamentally about how you judge which information to trust. It doesn't mean pouring through the evidence on every question yourself. You can't. Knowledge has become too vast and complex for any one person, scientist or otherwise, to convincingly master more than corners of it. Few working scientists, even at Caltech, can give a ground-up explanation of the phenomenon they study. They rely on information and techniques borrowed from other scientists. Knowledge and the virtues of the scientific orientation lives far more in the community than the individual, in this community. When we talk of a scientific community, we're pointing to something critical, that advanced science is a social enterprise characterized by intricate division of cognitive labor. Individual scientists, no less than the quacks, can be famously bullheaded, overly enamored of pet theories, dismissive of new evidence, and heedless of fallibility. Remember Max Planck's observation, science advances one funeral at a time. But as a community endeavor, it is beautifully self-correcting. Beautifully organized, it is not. When you see it up close, the scientific community looks like a rickety vehicle for getting to truth, with its muddled peer review process, badly written journal articles, subtly contemptuous letters to the editor, overtly contemptuous subreddit threads, and pompous pronouncements of the Academy, yet the hive mind swarms ever forward. It now advances knowledge in almost every realm of existence, even the humanities, where neuroscience and computerization are shaping understanding of everything from free will to how art and literature have evolved over time. Today, you become part of the scientific community, arguably the most powerful collective enterprise in human history. In doing so, you also inherit a role in explaining it and helping it reclaim territory of trust at a time when that territory has been shrinking. In my clinic and in my work in public health, I regularly encounter people who are deeply skeptical of even the most basic knowledge established by what journalists label mainstream science, as if the other thing is anything like science. Whether it's facts about physiology, nutrition, disease, medicines, you name it, the doubting is usually among my most, not least, educated patients. Education may expose people to science, but it has a countervailing effect as well, leading people, including you, to be more individualistic and more ideological. The mistake then is to believe that the educational credentials that you get today give you any special authority on truth. What you have gained is far more important, an understanding of what real truth-seeking looks like. It's not the effort of a single person, but of a group of people, the bigger the better, pursuing ideas with curiosity, inquisitiveness, openness, and discipline. As scientists, in other words. Even more than what you think, how you think matters. The stakes for understanding this could not be higher than they are today, because we're not just battling today over what it means to be scientists. We're battling over what it means to be citizens. So congratulations, graduates. Welcome to the battle. I know you're going to do us proud.